Good morning, everybody, and welcome to Weekly Wake Up, our opportunity to talk to our employees on a weekly basis and talk about important things that are going on in the district, whether that's about reintroduction. Today, it's about vaccines. We also try to hit, in future weeks, we'll be talking to some of our amazing teachers and staff members in regards to the practices that they're doing right now in the classroom. We want to make sure that this is always a relevant opportunity for you on a bright and early Monday morning. As you know, a lot of things have been going on in the last week. I do want to just make a mention that, as you probably saw, the governor continued to have his Big Friday press announcements. And one of the new things that he mentioned was that we are now in level yellow, both in Broomfield and Boulder counties. We are still, looking at what that means exactly. It didn't really change where we were in terms of cases. I mean, the good news there is at least that cases continue to trend downward. And so we're excited about that. It certainly will likely change some things in regards to the athletics and what's going to be allowed there. But again, it's a little premature for us to comment on that this morning. So I just want to kind of note that we're aware of it, but we're not necessarily going to talk about that this morning. Our main focus today is going to be about vaccines. And so I did also want to just immediately address the letter that went out to staff this weekend. Our intent, I want to be super clear right from the beginning, was not to reprimand employees. I understand that that's how some people read, especially those that had gotten their doses, read the message. And I do want to apologize, a heartfelt apology for me, since I sent out that message. That was not the intent. What we're trying to do is it's a little Wild West out there right now as doses come available. Essentially, what we've learned since then is that SEL was doing some legitimate efforts to try to get out vaccine that were thawed already, that were meant for 70 plus folks, but they hadn't gotten, all these appointments weren't necessarily filled throughout the day. And so, as you might have seen in the news, it got a little crazy at the National Western Stock Show as a lot of educators from Jeffco tried to rush out to try to take care of that need. Doesn't sound like it was quite as crazy here in the Boulder Valley area, but there certainly were opportunities available to staff that were legitimate. We also did definitely hear some cases in which people were sharing some links that were meant for other folks. And so that's where that original, copy in regards to trying to make sure that we're thinking about the folks that are where these doses are really meant for, somebody specific. We're trying to make sure that we're on that. But we're going to answer a whole lot more questions today in regards to vaccines. And so I want to go ahead and get started after acknowledging those things today and talk to our panel. So before we get too far, I do want to welcome our partner in this, a longtime partner in the Boulder Valley area from Boulder Community Health. This morning we've got the BCH Vice President of Operations and Chief, boy, I am just flubbing it up today, Chief Nursing Officer Jackie, and I have just misplaced the note that I have. How do you pronounce that? My apologies, Jackie. Do you want to?
No problem. Atlasy Priest, Jackie Atlasy Priest. Good morning, everybody. We're so excited to partner with all of you.
A little bit of a scramble and getting flustered and also losing my notes, so that's not good. One of our always on the show kind of guys is a frequent contributor is Dr. Chris Urbina. He is the Boulder and Broomfield County Public Health Medical Officer. Good morning, Chris.
Good morning.
Hi. We also have Stephanie Farron, our Director of Health Services. Good morning, Steph.
Good morning.
And Mike Grados, Assistant Superintendent of Health Services. Good morning, Mike.
Hey, good morning, everybody.
Okay, so I do want to remind everybody that if you do have a question, we are accepting those as always. And Selene, do you want to go ahead and introduce yourself? I see that you are on camera now. Good morning. Oh, you are muted.
Yeah, here I am. Good morning, everyone. I'm Selene Pinnell. I'm the Marketing Manager for Boulder Community Health. Thank you so much for having us this morning. We're really excited to talk about this partnership.
Thank you. And it wouldn't be Monday morning without trouble with the mute. I have that often. I'll try to just try to get my tongue to work for me at 7 o'clock in the morning. Okay. So again, I do want to remind everybody that we are taking questions. We've gotten quite a few already, great questions from our employees. That link that you can use is bit.ly, that's bit.ly/BVSD Wake Up. And so I do want to just go ahead and kick right off and just talk to our partners at Boulder Community Health. I think it goes without saying, but we are extremely excited to be offering vaccines to employees and to be partnering with you. Jackie, do you want to just briefly talk to us about this partnership and what we're going to be trying to do here?
Yes, we are excited. We have been working with Stephanie and really trying to find a way to smoothly get all of you who want the vaccine in through our vaccine clinic, which is located at the De La Cava building on our campus, which is in the Riverbend side of our campus. It is a building that has a parking ramp right next door. So it'd be very easy access. And we're going to be doing this on a series of Saturdays. And so we are very excited. You guys will all have your own private and very special clinic the next few Saturdays, and of course for your second dose as well. So again, we are very excited. I can't tell you how many parents are really excited that we are going to be able to start vaccinating all of you as well. So we're looking forward to this partnership. I think you're going to find it a terribly, wonderfully smooth process. Our clinic has probably gotten more kudos over the last couple months than any other program at BCH in its history. So it is a great process, and I think you're going to find it very easy to use.
And I did want to talk to you about that. I mean, this is not your first rodeo. You guys have been doing this for a while in terms of vaccinating our older population in our community. Do you want to just talk briefly about what that's looked like so far?
Yes. So of course we started out back in December with our own staff, and that's where we started the vaccine clinic. We learned a little bit, of course, with our own staff. And but within probably about 2 weeks, we had things down smooth. We can probably vaccinate if we could get enough vaccine. We could vaccinate probably 1,500 people in a day at this clinic. It runs that smooth, and we do have the staffing for it. What we've been typically doing every day, probably for the last 2 months it would be, is we have been doing about 600 to 800 a day on a regular basis, as long as we have the vaccine to do that. And that's, of course, both first shot and the second shot. We still need to do 2 with the vaccines that we have available to us at this point.
And I think that's an important thing to mention is, we can set up a construct, we can have an event that's planned. We really are at I don't want to say whim, but certainly at the discretion of how many vaccines are available at a given time. And right now it looks like things are ramping up, but again, that could change week to week. We're hoping for the best.
Yes, and you are exactly right. Right now, we feel really good about our supply for this week, and so we are excited to start on Saturday, vaccinating all of you.
So let's talk about that. I mean, when people get this invite, and again, Stephanie's going to talk a little bit about how we've done that, what the plan is on that side of things. But when they get that invite, I know that we're having them, go through a BCH application, or not application, app. Yeah, and have an account, and so then they can set up for a time. What will this look like when they get there? What's that process look like to sign up? That kind of thing.
Sure. So what we want all of you to do, and you can do this at any time, no matter when you get that invite, is to go out, if you don't already have a My BCH account, is to go out to bch.org. It's right on our website. There's a special section that will actually pop right up on our vaccines. And you can sign up there or through just the regular website for My BCH. It's very easy. You don't need to have seen anybody at BCH ever or had any association with us, but you can set up that account. It will ask you for some information. We're going to send out very specific instructions. So I'm not going to try to review all those specific instructions. But there will be a section that you'll need to go to get to that first dose. And it's really smooth. It's really easy to do. And then you'll be presented with the appointments that are available on a Saturday. And again, the first group will be released this week. And that will be for Saturday between 9 and 5 this coming weekend. You do need to get an appointment. So we don't take walk-ins because it does make the clinic run so much smoother when we actually have appointments. You will need to bring with you your BVSD badge, so whatever ID badge you have, a driver's license, and your insurance card. And I'm just going to mention about your insurance card. Doesn't mean that you're going to pay any money out of pocket at all. It is the way in which we can get reimbursed for giving the vaccine through the CARES Act. And so that's why we do bill your insurance. Again, no out of pocket at all for you all. And when you're signing up on that app, there's a little thing that says, don't bill my insurance. If you would please not choose that, because we do need that in order to proceed through and have the CARES Act. And for you to get an appointment, you need to not mark that. So again, we are very excited. I think you're going to find it smooth. When you get through, it'll be about, at the most, probably about a half-hour time frame. You do need to wait 15 minutes after you receive the vaccine, just to make sure that you're okay. We just monitor for any reactions, anything that happens after you get that shot. And then while you're waiting for that, you sign up for your second dose. And so that'll be really important. So you're all set to go and have that appointment before you even leave the clinic.
That is perfect. I know that I'll kind of ask a few of the questions that have come up to us for the application, for that kind of thing. If they've already got one, if they already go to a doctor or have been to the hospital, it's okay that they use that same one. You don't want them to sign up for another one with their BVSD account or whatever.
Absolutely. So yes, please, if you already have a MyBCH, you're all set to go. All you have to do is wait for the invitation from Stephanie.
And true to form, and when we send these things out, I think there were some maybe some technical difficulties the day that we sent out our message, but things are working pretty well now in terms of setting up those accounts and that kind of thing. I think we heard a few people say that they were having some issues, but I did want to just sort of mention that. You mentioned about the insurance thing as well. So I know that we obviously have the district insurance. There have been some staff members that have been worried that if it's not the district's insurance, it really doesn't matter who your insured is. The district is kind of giving you the spot in line, and you're just filling in your insurance information. And again, it's no cost to you. If you don't have insurance, that also, I mean, there's ways to work through that as well, right?
Correct. If there's no insurance, that's fine. You will still receive the vaccine, and we'll just record it as such. So again, no out of pocket for anybody.
Another question that we got was just the idea of, if you're a teacher that lives outside of the Boulder Valley area, that really doesn't impact this at all. Again, you're going to come to the location and take part with your other colleagues in the same place.
Yes, correct. So it doesn't matter where you live.
I know that Stephanie and I have talked about this a little bit, and I don't want to put you on the spot, but I know that there are some employees that worry that maybe a Saturday won't work for them. Obviously, our main focus is to try to have these big vaccination clinics, but there are plans to handle maybe those that really legitimately have no way to come on a Saturday. Is that accurate?
That is accurate. And so I think Stephanie will give you some information in regards to who you contact if that is the case, and we will work with you.
Well, I've got some questions for Stephanie too, so I'll just go ahead and have you, if that's okay to come to you, Stephanie. What would you like people to know in regards to that? Obviously, again, maybe there's just a way that they can contact us if they've got more questions in that arena, because again, our hope is that most people will be served by these.
Yeah, absolutely. Thanks, Randy. If anybody can't make that Saturday clinic, we just want them to reach out. They can reach out to either me or probably to Melissa, maybe in HR, and we'll work with them to do kind of a one-on-one, work around with BCH to get them an appointment during the week.
I guess, the question that's kind of come up with this whole situation with the invites that are coming up is, what do we hope for in terms of people signing up for things? Should they be trying to get it through their own provider? I think our answer to that up to this point is if you're eligible for a category like you're 70 plus, or I think what is it now for the state 65 plus as of today, that maybe go ahead and do that. I think the question that now starts to come up is what I'm hearing from our friends out in SCL was that part of the issue is that folks were kind of getting vaccinations wherever they could, and then those slots were then being left open, and that's part of the reason why they were having so many doses at the end of the day. I guess to Jackie, is there anything? I mean, you guys have kind of been doing this for a while. Is that one of the things that we have to kind of be worried about is appointments that are left open? If they are able to get it in another way, is it okay for them to cancel and then we'll fill it with somebody else? Is that kind of what we would do?
Yes, absolutely. So we haven't seen it in huge numbers, but we are starting to see that where people have been on multiple lists waiting to get it for whatever eligible vaccine they're able to get, and that is fine. We love that. I mean, as long as you're getting vaccinated, that's great. But we would really appreciate if you would cancel your appointment, and it's very easy to do again through that app. So that's great. So if you have gotten it elsewhere, you got in before you were scheduled to get it through BCH, if you just go in and cancel your appointment, that would be terrific. And then we can fill it with somebody else or know not to expect you.
Thank you for that, Jackie. Back to Stephanie. I guess that, again, we're kind of trying to tread this weird thing. I think we all thought that we were playing under a different set of rules in terms of, like, again, today was going to be the day that all the educators started, but it makes sense that again, if they're not trying to waste the doses. Anything else that you want to mention to folks in regards to how we should go about this? I know that our hope is if everything goes right, that we're able to get through the majority of our student-facing employees in 3 weeks. That's pretty amazing, but it also kind of takes us all working together to get there, right?
I think there were a couple of things, with everything COVID, right? Everything changes, everything sort of evolves as we move along. When this plan first came out to get educators vaccinated, of course, we were looking at March, and then Governor Polis moved, everybody up until today, which was wonderful. One of the things that happened with that was that each provider in the community was asked to partner either with a school district or with private schools or with childcare providers to actually provide that vaccine. And they needed to provide a number to the state of how many folks they were anticipating vaccinating. And then their allocations, my understanding is, came to those providers based on that. And so one of the things that we are concerned about is if folks are taking vaccines from somebody else who might not be able to get them, then BCH is going to have vaccine for all of our staff. We know that they've already put that request in. Some of the other providers in the community are working to vaccinate childcare providers and private schools and other agencies that are a little bit smaller and might have a more difficult time getting large amount of vaccines. So we want to make sure that we're not taking away from those folks, that we're also being very thoughtful in our partnership with BCH, because what they're doing for us is really incredible. And we want to make sure that, even as we hear stories again, and I think we talk about this a lot in the media and social media, that we're being very thoughtful about what's real information and what is kind of just spinning a little bit. And so if it's a week, before we are able to get it versus today and rushing out, and, I know, like you mentioned, what happened at National, the Western Complex, I think, it's a good idea to just be as thoughtful and patient as we possibly can. And that's a difficult thing right now, and we understand that.
Yeah, I do want to again say that we totally understand, and I want to blame the educators that for whatever reason, if you've had a legitimate, or if you've been shared a link and you just didn't know, and there's no blame to that. We understand, and I think the most important message that we want to say, and we said this in the message yesterday, was the idea that everyone, and I think Chris Urbina and your team last week said this really well. Our goal, public health's goal, everyone's goal, Boulder County or Boulder Community Health's goal, all of our goal is to get everyone vaccinated in the community. There is prioritization in part because there's scarcity, and I think that when you see, what happened, and again, when you talk to the folks from SCL, they actually had a great vaccination clinic all day long, and then it was this rush at the last hour when they had 200 doses that were available that got a little scary because people were driving a little erratically, and people were actually leaving their cars and rushing. They said it looked a little bit like the scene from The Walking Dead, and so I think that's what we're trying to avoid. We want to make sure that all employees know that we have a plan here. That even if we're going to talk about the prioritization here in a second, but if you're an exempt teacher, this plan is still to get you vaccinated, but we're prioritizing those that are right in front of students right now, for the reason that, again, we want to keep our schools open, and that's been kind of the push from the governor. So I just, again, this by no means is are we trying to reprimand teachers. We just want to be super clear about what we're doing here and why. Okay, so I do want to ask a few questions that have come in regards to that prioritization list. And I do want to just mention for folks, I'm going to just share my screen real quick here to show on the website where this stuff is. And so can you guys see my screen right now? Stephanie?
Yes.
Okay, thank you. I never know, and sometimes I just start going. So this is our staff employee portal. The vaccination button's right here, and if you click on that, it'll bring you to the page that we've built. It did take us a few days last week to get everything up and running, and we apologize for the delay there. You can get the letters that we've been sending right here. We've got some resources here. A little note about hopefully being considered. I do want to make just a quick mention about that. Why are we asking folks to be considered? Again, this is a situation in which not everybody's going to be able to get their vaccination at once. And so it is hard for those that are waiting in line to have people that are celebrating. We are all very, very excited. So it's just a note of consideration. Again, I understand that people want to celebrate when that happens. But I do want to kind of keep in mind other folks and additionally, on this page, and this is what we'll kind of talk about with Stephanie real quick, the district has come up with this phased approach, knowing that, again, we didn't have enough vaccinations for the first week for everyone to get done at once. Do you want to kind of talk about what went into that plan? And we have gotten a question. I'll just ask one specifically, in regards to why age, people have asked, why aren't health conditions considered, that kind of thing. Anything that you want to say in that regard as I turn this off?
Well, we worked through the prioritization that was provided at the time by CDC and CDPHE. We still haven't actually received anything from the state necessarily around prioritizing educator vaccines. So we took what we believe is the best approach to being able to vaccinate folks who potentially could have the highest risk for severe disease, which is exactly why we're using the vaccine, is the main reason why we're trying to get vaccine into folks. And so we know that in the first group on the top, you see the 1B1 phase, and those were almost a little over 600 folks who already got vaccinated through that phase that started a little bit ago in early January. And then we're moving into our ILC teachers. And then starting, like you mentioned, with age 65 and older, and then 60 to 64 who are student facing. We looked at age. We did not actually go with a prioritization around health conditions because in this phase, the state's vaccine plan actually calls for someone having 2 or more significant health conditions to be prioritized. And so in that situation, I have been instructing folks to talk to their provider specifically to see if there is a way that they can get vaccine, sooner than maybe we can get it for them. Like you mentioned, though, Randy, I think we're going to be able to get through just about everybody in 3 weeks, hopefully, as long as the vaccine continues to come in. And that's, before we even thought we were going to be able to start vaccinating folks to begin with. So we're moving through that way. We also did prioritize folks from racial and ethnic minorities. And one of those reasons is because we understand that folks in those populations have been significantly impacted disproportionately than the rest of us. And we wanted to make what's the term? We wanted to walk the walk a little bit. BVSD talks a lot about equity and excellence, and this was a way for us to really show that we believe that as well.
I do want to ask a few of the specific position questions that we've gotten. First and foremost, can anybody that's student facing get a vaccination?
Yes.
Yes, we want to be super clear about this, that we're not just talking about teachers.
Is that a trick question? No.
Right. No, and I think we've gotten that over and over again, and we could put out a list of folks, but everybody's always then wondering, I don't see my specific position or my name on there, and we want to be super clear that the purpose for this is student facing. We did get some additional questions in regards to that, in regards to, classroom monitors are included. However, it was also mentioned that that the vaccination information would be emailed to them in turn. They're just sort of wondering if they don't have a school ID, which I guess this might be a question more for Mike in regards to, have they all been issued? They're employees now, so how does that work for them?
Well, there are some of our employees who don't have IDs. Our classroom monitors don't, because they're in infrequently. They're like a substitute teacher, because our substitute teachers don't have them either. So the best thing they could do is probably, we could give the list to Boulder County Health of who those people are, so they can confirm to make sure that happens. And we did that last time with our partners at Safeway with the first round of the first phase. So we can do that for them. So we know that would be an issue. So they don't have badges, but we can give the list to Boulder County Health, and that way they know who those people are.
Okay. And again, I mean, classroom monitors, student facing. Another one that we got is, what about office staff in the school that back up the health clinic? I mean, I think already the fact that they would be interacting with parents or the public that come in there, you are absolutely, student public facing. Maybe we even widen that out in regards to just past the student aspect of it. What about, I'm a literacy paraeducator that works with 5 classrooms. So I think this is a question of, again, prioritization of those folks that touch multiple cohorts. Again, I think the plan hopefully is that we get through folks in just 3 weeks. So maybe that's not as necessary. Anything else that we want to say in regards to that, Steph?
I would just say that there are so many unique positions within the school district of folks who are working with, specialized groups, or who are moving from school to school. We really felt that the fairest way that we could do this was to follow something, completely and totally subjective, that there was no objective, there was no, option for us to decide what was more important than another. As far as the work that folks are doing. And again, I think it's also important to remember that this is one part of the prevention efforts, again, that we take over and over and over again. So masking, distancing, the vaccine, it all works together. And we have done really remarkably well. And I want to really stress that to our staff, to our parents as well. We are not seeing transmission in our schools, in our classrooms. Folks are doing a really great job.
Perfect. Mike, I know that. Oh, Chris, go ahead, please.
Thank you for saying that, Stephanie. That was on my mind rolling as people were talking about when am I going to get my vaccine? When am I going to get my vaccine? Is that we still need to do our multiple layers of protection while we roll this out, and then maybe after that, because we know that not everybody's going to get the vaccine. We know our children are not going to get the vaccine. And so for a while, at least. And so that all these layers of protection are still going to help all of us be protected against the COVID-19 virus. So thank you for saying that. And I don't think we can say that enough. Remind people that the vaccine is not a get out of jail card free. You need to continue to use the protection, because we hope that we get everyone as much as we can, and then we'll get the virus. No one will be more susceptible anymore, because the virus won't exist in our community.
I know another area, and I thank you for that, Dr. Rubina. I think you're absolutely right. I know you and I've had the conversation of, will folks, utilize masks and that kind of thing, in the future. We sure hope in some ways that people think about that as we get into cold and flu season of the future. So, although we know how people typically are, they'll sling those masks as soon as they don't have to wear them anymore. So I do want to get back to sort of, who's in and who's out and that kind of thing. Mike, we obviously have gotten a lot of questions in regards to teachers that are exempt. Again, the plan as it stands, that last grouping, I'm just going to show my screen one more time just so that we know what we're talking about here. When we look at the chart, the 4th group is intended to be for student-facing employees who want to rescind their exemption and then would work this school year. Again, I think the idea here is that you would get your full inoculation. So you'd be 2 weeks after you get that second dose. And then that you'd be open to coming back? I know that we've gotten a lot of questions in regards to who that is exactly, but let's start with the process. I know that this weekend, Melissa Riberty provided me a form, and we put that in the letter. So that is should be in your email box. We'll make sure, I believe it's on the website as well. That's kind of the starting spot. And then you guys have conversations from there. Do you want to kind of talk about that?
Yes. So that Google Sheet will be out, those who want to come back, but also a notification to the principal that they're interested in coming back, and the notification to HR, and we'll work with that. Randy, the question around exemptions has come up a lot. I've answered a lot of emails with that. And I just want everybody to understand, and I think we've already said it here, the goal is to get everybody vaccinated. That is not in any way, shape, or form that we're excluding the teachers that are exempt. They're exempt for a good reason. So given that information, what we want to make sure is that within that fourth group, we can vaccinate because in the time that we have and the vaccination supply that we hope we'll be getting, we'll be able to do that. But once we do, the rescinding their exemption would be important to us so that we can staff our schools for the remainder of the year and get ready for next fall. So that's important to us. It's important to our kids. Our kids need us. So I think if we can think about it that way, I like to see it that way. And I think as a whole, we would like to. But I don't want to give the impression that exemption teachers have been kind of put off to the side, so to speak. They have not. It's just that under the governor's order, student facing was the first priority that we all had to adhere to. And we're doing that.
And to that point too, it is kind of a dueling priority, because at the same time, like we said earlier, he's continuing to lower the age groupings.
Yes.
And so now, as of this week, it's 65 plus. I know some of the counties are not necessarily to that place yet, and they're communicating out in regards to what that looks like. But Chris, one of the questions that we got is, if they're on a leave of absence, but they're 62 years old, do they have to, if they're not going to be participating in this, how do they get their vaccination? That would be, once that age group then comes up, you would certainly be able to do that through your personal provider at that point, or through the county.
Are you asking me that, Randy, or Michael?
Yeah, if that's okay.
Sure. We don't know yet. I think it depends on the governor's priorities. I think that changing prioritization list is still a little bit of a mystery in how that's developed to us. So we're responding to that and trying to be consistent across the state. The challenge is, I think that next group will probably be those other essential workers. So I think as we hear more, we'll be communicating that. And hopefully at a future Wake Up BVSD, we'll have that conversation again as we have more answers. But also I think we're trying to communicate that on our BOCO website as well, what those prioritizations are and who those providers are. And so as we get more vaccine, you can see that this is another prioritization by the governor saying, let's put teachers out there in front. And so this is good for teachers, but that next group of people with medical conditions are saying, so when is my turn? Right. And so I think that's some of the expectations we have to handle. And I know we were talking about this a little bit earlier, it's human nature to say, when am I going to get my vaccine? Like the big run on toilet paper that we talked about, there's this expectation that I got to get my vaccine. I got to get my vaccine. Well, as Stephanie and I both mentioned earlier, we'll know as we get more vaccine, but still using those prevention, those layers of protection are still important as we get everybody vaccinated.
I do want to just have you mention too that according to the governor's plan, which as you just mentioned is open to change along the way here, but right now it looks like the majority of Coloradans that are not part of these prioritized groups would have the opportunity in the summer. Is that still the thinking that we've got?
Yeah, I think it all depends on the availability of vaccine, Randy. I think it's as we get more vaccine, we have lots of providers that are ready to give it in Boulder County, and thanks to BCH and some of the other health systems that have done a great job of stepping up to help with teachers. As they, and Jackie said this earlier, as they get more vaccine, they're more than happy to provide that to the community, whether or not they're a patient or not. So I think it really is dependent. I would be remiss in saying, on X date you're going to get your vaccine, because we just don't know. And the future is there are other vaccines that are in the pipeline. You know, Johnson & Johnson is going to apply for FDA approval in the next couple of weeks, which I think is very exciting. So I think that we just have to be a little bit patient and use our prevention strategies as we wait for more vaccine.
And I think sometimes the most important thing there is just to say we don't know, and I appreciate you just saying that honestly. I do want to make sure, we did get a question just now in regards to the sort of, Dr. Bina was mentioning that we have so many providers that are willing to provide it. The question that just came in was the idea that, last week, Safeway and King Soopers, I think it was Safeway for us, were vaccination locations for 1B.1 group. Now it's BCH. I think first, Stephanie, again, we've looked at different places for different needs. We're always looking to make sure that we have the opportunity to get these vaccinations out. BCH is a great partner in that. Is there anything else you want to say on that before I come back to our BCH partner to talk about, again, where that location will be?
I think what's important to recognize is that the counties are really trying to work with the state and also with all of us and the local providers in the community to make sure that they can find the agency that's going to be able to do, to work with each of us best. And so at the county level, Chris Campbell and Indira have been working really hard to kind of fit providers with folks who need vaccine based on the number of vaccine they can get, how quickly they can get it out to the communities, what systems they have in place to work that vaccine out to folks. So you're right. We partnered with Safeway before to get those folks done, and they did an incredible job. And now we're really thrilled to be working with BCH and knowing that they can set up these whole day clinics for us to do, hopefully 1,000 folks at a time. I mean, it's just a remarkable opportunity. And hopefully we won't go to somebody else, but, again, things change, vaccine changes, the state changes how they want things done. And so we never know, right? We just don't ever know.
Well, and again, I think the important thing for folks to know is, again, we were sending notifications on 1B.1 prior, and it had certain instructions. This group will have a new kind of email with the information, and I know Jackie kind of mentioned that directly. Stephanie, can you just quickly kind of talk about, we are going to be, again, prioritizing groups, and then that group will be getting, starting today, we'll have HR, I guess, is going to be sending out that message.
Yeah, we should be sending out 1,000 invites today to sign up for the clinic on Saturday, and then midweek we'll work with BCH to find out how many folks are, have taken up that appointment. And if we find out we've got a couple hundred appointments left, then we'll send another 200 out based on that priority list that's on our website.
Yeah, and again, I want to specifically say that, again, that was a question that just came in this morning, is the idea, okay, given what we've seen elsewhere, what will that process look like? We are not, I will say this from communication, I am not going to send a district-wide communication that says, hey, 100 vaccines left, go, get in line.
That would be a quick end to our partnership,
right?
That would be a quick end to our partnership, Randy. No, I like things nice and orderly, and I'm sure BCH will appreciate that as well. We don't want people, going and getting frustrated and waiting. We want people to be able to make an appointment, go there, know that they can, go through that process, and like Jackie said, hopefully take about a half an hour, and then they're on their way.
Mike, did you want to add real quick? Go ahead, Mike.
Randy, just into kind of jump on that a little bit. We've had good practice because with 1B.1, we've been able to be successful with that process, even though it wasn't as many numbers. We were still able to be very, very efficient in terms of getting the message out to those numbers of people, not only through email, but through a school messenger phone, a voicemail. Look at your email. There's an important message regarding vaccination. So that's helped a lot.
Perfect.
And I'll
Jack-
just add, I don't envy Stephanie and Michael or whoever is doing this prioritization. It is a challenge. I had to do it as well for our staff. It is just a way, is exactly what we're talking about, is to get everybody through, and that is the goal, everybody through in a very orderly manner. It is not about, a week difference, those kinds of things of trying to get in the front of the line. I understand it. I know it's, as Chris said too, it's human nature, but we are very committed to getting all of you in BVSD vaccinated. So, and we would really, really encourage you to get vaccinated. So when it is your time, I would encourage you to get this vaccine. I've gotten it. It is something that will, as Chris said, help us be better protected and get this virus down to a controllable, manageable size in our community. So again, I would really encourage you not to get too anxious about where you are in line, and just be ready to go when your time is there. And again, BCH is very committed to getting you all vaccinated.
And again, for those folks, we've had about 100 more folks that have joined our stream. I just want to have you say, when it's time, and we don't want people to show up, just waiting in the parking lot or whatever if they don't have an appointment. But where is it going to be happening?
So yes, when you have your appointment, it'll probably be, as you have your appointment, it'll show up as well. But this is in our Della Cava building. So this is the building that is on the Riverbend side of the Foothills campus, so off of Arapahoe. You turn on 48th Street, and instead of turning left when you come into the campus to go to the hospital and the emergency room, you go right. The Della Cava building is the first building. Right next to it, when you go by the building, there's a very lovely parking ramp. So you can park in that parking ramp, head into the Della Cava building. You go up to the second floor. There's either elevators or stairs to get up there. And it's a beautifully laid out empty floor that we had. So there's lots of room. We would ask you again to continue to socially distance and wear your mask, of course, when you come. But the process is very smooth. We've got it down really well. It'll be very easy for you to get through that clinic in that half-hour period of time.
Perfect. Thank you. And I do want to transition back over to Chris for a second here. What Jackie was saying is absolutely true. I mean, we really want people to know that the vaccines that we have in front of us here are, very, very safe. They've been shown to be very effective. And so a couple questions that we got that I'll just pose to you if you're okay is, I'm afraid of getting my vaccine because there's not been enough time for testing. What is the impact of me not getting my vaccine when it changes?
When the vaccine changes or when the virus changes?
I think when the virus changes.
So I just want to throw a shout out to the providers out there. We've given over 40 million doses of this vaccine in this country, 40 million doses. And we get side effects from it. People get a sore arm. They maybe get fever, chills, may feel a little fatigued, but that's to be expected because that's your immune system revving up to respond to this spike protein that's injected into your arm. There are very few contraindications to the vaccine. So I understand why people are hesitant about it, but it's been studied for months. There were tens of thousands of people that were tested in the clinical trials, and they found out that these are important side effects from the vaccine. So I'm being very upfront that this is what will probably might happen to the majority of people, and a little stronger after the second dose. But the virus is very safe and highly effective. So I see Jackie got her complete dose. I got my first dose, and I have a sore arm, but it's not a big deal. Expected. So I just feel like the vaccine is working. So in terms of feeling like it was rushed, the same kind of process that people went through to look at other vaccines were studied these vaccines. I think people are worried because it's an mRNA kind of new technology. Well, that technology has been around for decades. We used it with other viruses like Zika. And so that people should learn the facts. You can go to boco.org on our website. You can go to the state health website. You can go to CDC website. Ask the questions. I know, Jackie, you hand out a little brochure that says, this is the vaccine. This is how it works. These are the contraindications. So people should read that in anticipation and then make that decision, because it is an extremely safe vaccine. Now, the question about the variants is a good one. All viruses mutate. And as they mutate, they change their site around how, because that's just what viruses do. Now, it turns out that these viruses are changing enough that they're becoming more contagious. And that's true about the UK variant and probably about the South African variant. But there's still, the vaccines that we're giving right now are still effective. They're not as effective as the 94 and 95%, but they're still very effective. So it's worthwhile getting it. So I wouldn't wait for another vaccine. If that's what the question is, I would just get it right now, and then we'll use our prevention strategies going forward.
Chris, I've got a few other vaccination questions, but Jackie, did you want to add just in terms of what things look like at the clinic and what you've seen so far?
Chris is absolutely right. These vaccines do cause some side effects. They're manageable side effects. We have not seen many immediate reactions at all at the clinic. Very few people have reacted. It will happen, I'm sure. Every state has seen some reaction to the vaccine, but again, we are prepared for that at the vaccine itself. I would really encourage you to do that. Chris gave you some resources. There's also a great video out on the bch.org website that our superstar infectious disease docs did that really helped to explain the vaccine and review the side effects and what we know about it. Again, it was tested in the same way that a lot of our other vaccines have been tested. It just didn't take as long because we do know this virus and how viral vaccines work. And as Chris said, this particular type of vaccine has been studied and been around for about 40 years.
I do want to mention too, last week we kind of talked about the idea that people being sick and, I think part of the reason that the vaccination clinics are being set up on a Saturday is to give some of that leeway time over a weekend. Am I accurate in saying that? I'm not. Yeah, Jackie.
You are. We thought that would be a nice ability for you all to be able to handle those side effects, especially with the second shot. I agree with Chris. The first one is a little bit easier. The second one usually has a little bit stronger side effects, but they are really about 24 hours, 36 hours long. And so you'll be ready to go back to work on Monday.
Okay. I know, Mike, we had gotten some questions in regards to if for whatever reason someone does have a bad reaction and it's a few days or whatever, does their COVID sick leave apply at that point that they typically would use for like a quarantine, or any sort of thoughts in regards to how that will work?
Yeah, that would work at that time. That would kick in. The thing that we want to do is make sure that they're well when they come back, and they can work with their supervisor on that as well. So we're not wanting to punish anybody because they had a side effect. We definitely want to be sensitive to that. Our employees that work so hard over this COVID, we're going to do everything we can to help them out, even if it means we don't need to charge them. If there are people that can cover for them and not charge them their annual leave, that's great, because some of them do have lots of hours of accumulative leave, and COVID doesn't kick in for them because they already have more than the 80 hours that they need for COVID leave. So we'll do everything we can. And we've talked to principals and supervisors about that. Work with your people. The good news, you're getting the vaccine. That's the goal here.
Totally.
So
yeah, and I know that the same is true. I think we answered this last week, but the idea that if for whatever reason, if you are one of the few that can't make it on a Saturday and arrange that our teams have been instructed to try to work with you on that, because again, this is vitally important in our minds. Chris, I do want to come back. Oh, Mike, did you want to say anything more on that? I'm sorry, I started bulldozing.
No, correct. You're absolutely yeah.
Got to be polite. We did get a few other vaccination-related questions. Let me ask both of these right in tandem here. If I'm pregnant, do I still need to take the vaccine? Or I guess the additional question would be, is that advised? And then secondly, is there any information about the vaccine schedule for students? Specifically, I think that there's 16-year-olds and older can get the vaccination. They would be part of the general population at that point, I would imagine, right?
Yeah, let me answer that first question first. Pfizer is the only one that's currently recommended for 16 and older because it was studied that way. Now, all of the clinical trials are now looking at children younger than that, probably preteens and teens. These are stepwide kind of usual process of approving these vaccines, and those trials are going on right now. Hopefully we'll hear more information by the summer of who is going to be vaccinated, what dose. Is it going to be one single dose? Will it be two, a different size? All those questions are being asked right now. So we probably won't know that this spring, but probably by summer and next fall we'll know whether or not children are going to be eligible for both of these vaccines. And I know the other vaccines, Johnson & Johnson, AstraZeneca, and Novavax, the other one, and Novavax, are also being studied with children, so we'll know more about that in the future. So hopefully stay tuned. But in the middle, and always prevention strategies. We can stop this virus from spreading by doing those things. We'll go back to the original question about pregnancy. The unfortunate thing is the vaccine wasn't studied among pregnant women. It wasn't, the pregnant women weren't called out, or breastfeeding women as well. So we think that it's safe in pregnant women. Pregnant women obviously got the vaccine because they didn't know either they were pregnant or just they wanted to get the vaccine, because there are complications associated with the virus itself if you get the virus while you're pregnant. And so the pregnant woman and their family need to make that decision. It's likely that because it's an mRNA virus, it doesn't cause infection. It revs up your immune system, like Jackie talked about earlier, so that it's probably safe. But that's a decision that you have to make as a pregnant woman with your partner. And I would encourage you to talk to your health provider to have that discussion, because particularly if you're a high-risk person who would have complications if you got the infection, then I think you have to make that decision. The issue is probably that it's less effective. Your immune system isn't revved up to handle both the infection or the immunization, but it's still worthwhile getting the vaccine if that's what you choose to do. So it's really a choice that you have to make, and talk to your provider, talk to your family.
While I've got you up, Chris, two things I'll just mention back to, the layers of protection. I know that a lot of folks have, especially community members, parents, have asked, will this, as soon as everybody's done, will it be a snap that will, suddenly be back to school? And the answer is we are going to be monitoring this very closely in partnership with you guys. We do have a heart for trying to have kids in school as much as possible. But at the same time, to your point, not all kids will be vaccinated. Our families aren't vaccinated yet. Additionally, we are closely watching these variants. And I know that some of the thoughts are that there could be some peak of those things starting in, March-ish, and again, that's very much just forecast stuff. But you just want to kind of just mention that we're watching all these things closely, planning for the future of more student engagement. The other question that we've gotten, and I don't know if you want to say anything on that, but I also just mentioned real quick that, and it feels like the perennial question. It was, I think, Halloween time frame that we were talking about the holidays and travel and whether or not people should be participating. The question's back now with spring break, and we got variants on top of it. So it's sort of like the 2+ question. Any sort of advice? It doesn't sound like there are, certainly in certain places there are travel restrictions, but again, I think it's the same advice that we've been giving for some months now in regards to protection and being careful about travel and that kind of thing. Anything that you want to say in regards to spring break?
Sure. I think people should use their judgment. Obviously, we are very concerned that the virus is still in our community. Yes, cases are going down. Yes, hospitalizations and deaths are going down, which is all tremendous. If we let down our guard and don't use protections, and with the onset of new variants, particularly that are more transmissible, particularly the UK variant, then we have this potential for having more infections and spread of this virus. Now, not everybody is as good as Boulder County or Colorado. We have tremendous uptake of people using masks and physical distancing. If you travel outside of the state where the regulations and the use of masks and physical distancing, I watch this on TV, I can't believe that they're not wearing masks and physical distancing. Of course, I'm a public health official, and I kind of think this works. So I do think that if you're traveling, if you're going to places where there's still significant transmission, then you're at risk of getting the infection. So wherever you go, use protection, and I think you'll be okay. So Do I think people should travel? Probably not, but then that's their choice. If they do travel, they should use protection and consider, being careful when they come back, wherever they go. So that's just my advice.
Here's another question, Chris, that just came in regards to, that the vaccination isn't necessarily a quote unquote cure. And again, I think that's partly why we're really encouraging folks to continue those layers of prevention moving forward, like wearing their face coverings and that kind of thing. Anything more that you'd want to say in regards to that?
Sure. The early studies showed that these vaccines were highly effective at reducing moderate to severe disease and likely to reduce the spread of the infection. Now, no vaccine is 100%, so that 100% effective. So we have to think about this so that if it's not 100% effective, even though very effective, more effective than most vaccines, that we still have to use our heads and use protection to prevent the spread of disease, particularly of people who can't get the vaccine or are still potentially not because their turn isn't up to get the vaccine. So we still have to protect ourselves while we go through this period of creating immunity to protect all of us in our community. So.
And another question that was similar to that idea was in regards to the testing for that. If tested, and if you had vaccination but in a mild case of COVID, would those still show up in a normal COVID test?
Sure. The normal COVID test tests for a presence of the nucleic acid of the virus itself. So the vaccine doesn't give you the infection. So that PCR test or that antigen test isn't going to be positive if you get the vaccine. Now, it will produce antibodies. So it's likely that you will have antibodies after you get the vaccine. But why to do that test? There's no reason to get the test after you've gotten the vaccine. We know it's 94 to 95% effective. It's going to be effective. No reason to get antibodies. Now, what we don't know is with the new variants is whether or not the new variants will be picked up with the same PCR tests that we're doing. So we're looking at those tests as well as making sure, but it's likely that they'll be effective at that. So I think the other question we have is people often ask us is, are the current treatments associated with COVID-19 still effective against the variants? And the answer is yes. Remdesivir, which is an antiviral, as well as the steroids are certainly highly effective. Now, the serum or the convalescent antibodies are probably not going to be as effective because those were to the old virus. Those antibodies were to the old virus. The new variants may not be as effective using that convalescent serum. So what I would suggest is that regardless of whether or not it's a new variant in our community or an old virus, which is really only 6 to 9 months old, the same prevention strategies that we're using are still highly effective. I think if you want to wear a double mask, you can, but I think those are uncomfortable. If you wear a mask properly, covering your nose and mouth, that should be enough to be effective. And physical distancing and washing your hands and avoiding large crowds are still highly effective while we gear up the vaccine. I know I sound like a broken record, but that's really my job to be that, to tell you that these prevention strategies prevent you from getting the infection. And if everybody does that, we're going to continue to see those cases, hospitalizations, and death go way down, and protect our parents, our kids, and our teachers going back to school as we gear up with our partner at BCH to get everybody vaccinated.
And this, Jackie.
Oh, yeah, Jackie.
I just want to add to Chris's comments is that we on myself, on behalf of all of BCH and their employees, want to thank all of you for doing these prevention strategies. It has helped keep our community manageable from a hospitalization perspective. And again, they're so important. And so we want to thank you all for doing that. And I want to thank you on behalf of our staff for what you do for our young people each and every day. I know this last year has been extremely tough for you all, and we really thank you for this last year, but also every year of what you do to help our young people educate and become wonderful adults. So thank you.
Well, I've got you up, Jackie. I'm just going to quickly bring up this question again, just to be absolutely clear. If I'm a current patient, I have a BCH account. and and I wish to be vaccinated, all I need to do is wait for that invitation. That is accurate. You'll get the information if you're student facing. We will be sending that information, and all you have to do is then go and put in for the appointment that you would like in that app.
Correct. And again, you just have to have that My BCH account, because you could be associated with BCH and not yet set up your account. So just make sure that you have that My BCH account where you can get your test results, where you can get information from your physician, et cetera. That's the app that we're talking about. So that'll be really important. And that's how it gets to be a smooth appointment process.
I want to recognize that it is 8 o'clock. For Jackie and Chris, I want to let you off the hook and let you get back to work here. I think we have covered the questions that we had for you. Mike and Steph, do you mind just hanging on for 5 more minutes to answer a few more specific questions?
Thank you.
Thank you both.
Thank you. Have a great day.
We have gotten so many questions that have to do with specific positions and that kind of stuff, and I just want to try to do our best to answer them if you guys are willing, and I appreciate you being on the hot seat about this. One of the questions that we're not, and again, plenty of things have been coming in this morning in regards to, okay, so if I'm an exempt employee or I'm on a leave of absence, et cetera, what is the plan for me? The plan is essentially you are part of the general population at that point, because again, under the governor's orders, our focus is inoculating teachers that are in classroom that will support students either now or immediately. And I know, Stephanie, A, just make sure I'm correct in that, but then also B, what we've also talked about is that there would be the opportunity likely if teachers are moving, or maybe this is more of a Mike question, moving from one role to another. So we've gotten questions in regards to BU, online teachers. We've gotten questions about TOSAs. If you're covering for classrooms, I think you'd probably be considered an in-person. If you're, are swapping into a new role for the fall, then obviously there's a new wish for us to get you vaccinated at that point. That's covering a lot of territory there. Anybody willing to kind of just talk about sort of our thinking as we go forward here?
I'm going to leave that one for Mike.
Yeah. So look, I think that again, the goal is for everybody to be vaccinated. So if you're student facing and you're in buildings, if you're a TOSA and you're in buildings, you're going to get vaccinated. If you're not, you're going to fall hopefully in the group 4, depending on the supply of the vaccine. We're hoping that, because we definitely want people to get vaccinated. Again, that's the whole goal of everybody getting vaccinated. All 4,000 something, whatever employees we have, we want everybody to get vaccinated. So I think, Randy, to the questions I received, because I think they're related to the comments that you're making, is I know a lot of the exempt employees that I've talked to, they kind of feel penalized because of them being exempt, and it's not that it's a penalty for being exempt. It really is the priority of the kids that are or the staff that are facing kids right now are at higher risk than an exempt teacher being at home. So that's the priority, and that's the way we need to look at it. So anybody that we know that is student face is going to get a vaccination, okay? And they're going to go within that age group that we have under each of those categories in prioritization. So they'll fall within that age group. So I hope I've answered that question, Stephanie, if I left anything out in terms of what our philosophy is and what we are. But a lot of people also have to understand that this is not, our prioritization is something that Boulder Valley built on what we've heard from the health departments and from the governor. It's not that we decided to do this and then lay it on everybody and then think about it. And again, these guidance will change again. So once guidance change, there'll be another communication out as to what that guidance is.
And I think that's really important to say. I think Dr. Rabina kind of spoke to that too, of, we're talking in terms of like as certain as we can be right now, but again, we wouldn't have expected that we would be in level yellow today, for instance. And so,
right.
Again, we're focusing on trying to get all of our student facing teachers, if it's possible. And I know that, if it's possible, we want to get every employee to be vaccinated. Again, I'm hoping the fall could be, very much trying to get back to, a semblance of normal. Again, it's a little early to know what that looks like, but I do want to just mention too that it's not, again, just to Mike's point about penalization, central administration staff, I'm thinking about cabinet, and I'm thinking about, folks that aren't in schools on a normal basis. Of course, if they're subbing in, if they're helping on that kind of side of things, of course, they would be included. But I mean, that because we've got a heart for trying to make sure our teachers are vaccinated first, and under this right now, if they're not student facing, that's not our concern at this moment. I want to be as frank as we can. It's not just about exempted teachers or teachers that are on leave. So
the exemption to that rule, if we have employees that are 65 and older and are not student facing, they already qualify for a vaccination. Because I've had some of those questions. We do have some of our great employees are anywhere from 65 to 75. And they've asked me, am I going to be in line for a vaccination? And the answer is yes, even though I'm not student facing. The answer is yes, because that's what the guidance calls for right now.
And I get, that does go to some of the other questions that we've gotten in regards to if I am in Kaiser and they've reached out to me and they're willing to take me. Yeah, I mean, and again, it's a little Wild West. We're trying to be fair and equitable and all those kind of things. We've got our priorities, but if you have an ability, what we're just asking folks to be really cognizant of, if you're getting something that looks like it was cut and paste, maybe from somebody else's email, or if you've got your link for you as an employee, we're asking you not to share that. So just, and Stephanie, anything that you want to add in that regard?
That's exactly what I was going to say. And I have, we will continue to encourage folks, especially folks with health conditions or other, situations, to reach out to their provider. When all of the vaccines sort of became available, we encouraged folks to get on, as many lists as they could, whether that was through Boulder County or Broomfield County, through Kaiser or UMR, to talk to their providers. And we still encourage you to do that. Work with your provider. If something comes up, if you're at Safeway and they say, hey, we've got some shots that are available right now, get in line and get them. We don't want people to not do that. But like you mentioned, Randy, we just want to make sure that we're not taking vaccine that's, specifically directed for other folks. And let us know, right?
Yeah,
if you've gotten your vaccine, through somebody else, let us know. And that way we can move somebody else up on our list as well.
That was another question that we've gotten, is the idea of, okay, so what do you do if I've been able to get it there? Again, as our friends from Boulder Community Health said, please cancel your appointment.
Yeah.
If I guess two more questions here, and I apologize, I probably should have asked her when she was here, but the idea that if you've gotten vaccinated through another organization, Kaiser, SEL, whatever, you haven't gotten your second dose yet, that you're typically set up to get your second dose through them. We would probably encourage them to keep that.
Yes, you. My understanding is that you need to get your second dose where you got your first dose.
Okay.
So we would not, and you have to get the same vaccine. So anybody who's gotten a dose should have already made an appointment for their second dose, and you should continue with that. Absolutely.
And then additionally, as you were just saying, we want, part of this is going to be about quarantines, and part of this is, there's going to be a process here. Do we know what that's going to look like yet in terms of registering, our information on vaccinations? Is it going to be through your school like the measles were, or?
I think what we're going to want to do is probably do it like we did with the measles, where you provide the information to your school, and then there's a database that gets sent to HR, and then we have a record of all of that, just like we do now with our measles shot. And
again, we got a question that was about, this is not mandatory at this time. That's not the case, but we're encouraging to take part in it. Again, it could be, we knowing that it's another layer of protection, as Dr. Urbina talked about, it really could be a game changer for us in terms of returning back to school. But we want to be upfront and frank in regards to our approach to it, that at this point it's not mandatory.
Right. Right now, Randy, the guidance that's come out through the state is that 2 weeks after your second dose, you are considered fully immunized, and you would not have to quarantine if you were exposed. So if there was somebody in your classroom or you were notified that that you were around somebody, you would not have to quarantine. But let me, be really clear that that doesn't mean that you don't still have to watch for symptoms. Because like Dr. Bina mentioned, this is not 100% effective. So if you're exposed to somebody, even after your vaccine, you want to make sure that for 14 days, you're monitoring yourself for symptoms. If you were to develop symptoms, you would be treated the same as if you didn't have a vaccine. The same thing for folks who get ill, even after they get their vaccine. We follow the same protocols right now around major and minor symptoms, 24 hours and 48 hours to resolve. And if they don't, then we are still going to ask you to get a COVID test, because again, this is not 100% effective, which is, to Dr. Urbina's point, why we still are masking, we're still staying distanced, we're doing all the same precautions even after you get the vaccine. Until we get to that point of enough folks being vaccinated, enough folks being immune, that we can start looking at things differently.
Perfect. And I think, as you can kind of hear from our team here, that we are trying to be as heartfelt. People have questions. We want people to reach out. We understand that oftentimes we're talking in blanket terms, about the whole picture, and so everybody's got their own specific deals. Again, on the exemption side of things, Mike, if they have questions, that should come to HR and they can work on those things. If they're, if they're an online teacher and they want to teach, in person, but they were assigned online, I think what I'm hearing from you is that we want to work with them on that.
Yeah, that's
okay.
Correct. That's correct. My hope, I think, Stephanie, you probably could maybe know a little more, but I believe if the dosages come in the way they're coming in at 1,000 a week, we're going to be able to do that. We're going to be able to get everybody vaccinated.
Perfect. I think that's probably the gist of it. As you can kind of hear, we still are getting questions about, can substitute teachers and, student teachers, that kind of thing. If they're involved with us, employed by us, they're student facing, all those are categories. The other question that I just saw again is just the idea, that if you are categorized for another reason, our effort obviously will be based on our prioritization, and we'll be trying to get people in there as quick as we can based on our priorities. But if you've got another one, then obviously, if you're 70 plus, get in there and get that vaccine. There are opportunities right now for that. So anything else as I close up? I apologize for seeming a little flustered, but there have been so many questions that have come in. I feel I really want to make sure that employees feel like they're getting their questions answered. Anything that dawns on you that based on the questions that you guys have been getting that you want to make sure we get across?
I think if we could potentially link to the vaccine video that BCH mentioned. I know that a lot of people are really, worried or concerned, just unsure about the vaccine because it is something that came so quickly. I want to also stress that, like Dr. Bina and Jackie mentioned, this is technology that's been around for a long time. It's been studied for, with tens of thousands of people. And like Dr. Bina mentioned, 40 million Americans have gotten the vaccine already. But if folks have more questions about the vaccine specifically, if we can link to some more information for them and know that, excuse me, using CDC, CDPHE as good reference points for information. And you can always reach out to me as well. Excuse me, and I'll try to get information back as quickly as I can.
Mike, anything else from your point of view?
Just remember, be patient. But I think the other thing that I missed was probably student facing, like our student teachers, they would be covered. We do have other folks within our buildings that are student faced. Practicum students, things like that, we would definitely get them vaccinated because they're in front of kids.
So we did get a question about what's an example of a non-facing job. Obviously, again, a lot of folks just trying to check and see where they're at in the scheme of things. Our network staff members considered student facing. How are we looking at that? And then my second question too would be just the idea that I know one of the questions that we've got on student teachers is if they're, unlike most BVSD employees where they've got a BVSD email account, do we have ways that we've got them kind of on a list and can make sure that they get notified and that kind of thing?
Yeah, we do. And they have BVSD account. Yeah, they do have BVSD email as well. So they're easy to communicate as well. So yes, that's true.
Let's see here. I think that is it. We did get one about, is there a county location? This is a little bit like the big vaccination clinics that are held at like, Invesco Field or the Rocky Stadium. It was Coors, right? Anyway, where we are just really putting all of our resources into a vaccination clinic in one spot here in Boulder. So I do apologize that there are not multiple locations for that. Another one that just came in is the idea that if you got your first, we kind of just answered this a few minutes ago, if you've got your first dose at Safeway, yes, you do go back to the same location. So go back to Safeway for that second dose. We're not going to try to switch that up on you. Gosh, I appreciate you guys answering so many questions. No doubt these will continue to come in, and we'll work to have them on the FAQ site. We will make sure, we got a question about where is that app, for Boulder Community Health. It was in the letters, but we'll make sure that's on the website. We'll make sure that we've got the information about vaccine safety on there. That place will be our hub. That's where we will have updates. And again, I just want to say one last, regretful apology for the note that made it sound like we were going after the staff members that had gotten vaccinated. That was not our intent. By all means, we want to make sure that everyone is vaccinated. We just are trying to be very thoughtful in regards to this and careful so that it's not a melee. But we so appreciate the fact that staff members are excited to get this. We wish that there was a billion doses just waiting so we could just do it today. But again, we are going to get through this very quickly within the next 3 weeks. Hopefully, the first group of doses will be done. So, I mean, how exciting is that? So, okay, I hope that you all have a great day. Thank you for waking up with us.